Number 6, treatment. The definition of treatment is a therapeutic agent, therapy, or procedure used to treat a medical condition. Post-traumatic stress is defined as a medical condition. It appears in the DSM-5. It's a label. I'm sorry, I don't like labels. I always believe that the label is more beneficial to the person who gives the label, the labeler, than the person who receives the label, the labelee. And I often hear people who come to work with me actually start identifying with the label. I am traumatized, right? So I'd like to talk to you about what a gold standard high efficacy treatment what look like, what it might sound like, what it might feel like to administer. A gold standard should be based on the neuroscience of visual spatial tasking, and I'm going to describe that in a moment in depth. It should also be drug-free, because I worked for victim services for about a 2-year period, and I would see people who were traumatized on the weekend, say Saturday or Sunday, and I saw them on a Tuesday or Wednesday, and they hadn't slept for 2 or 3 nights. We do the trauma intervention, and they sleep that night. So they don't need sleeping drugs, is my point. So it can be drug-free. The intervention should be brief and non-retraumatizing. Now, you guys are all NLP people. You know how brief NLP interventions are, and you know that you can do them in a non-retraumatizing way. You know that with your skill set, you can keep people safe. We're taught that at our very fundamental level of NLP. Now, I have introduced into my practice, and I teach this, I call it evidence proven. And we prove our evidence with every client. It's not evidence-based. That's not what we say. We say evidence proven. It is evidence-based in research as well, but I resist evidence-based because some clinicians talk about using evidence-based, and the evidence is 10, 20, 30 years old. And the evidence, like in cognitive behavioral therapy, some of that evidence, when you do the research review, shows less than 50% efficacy with 80% recurrence. So yeah, they have success. It's evidence-based, but the evidence is horrible. And if you talk to me about all the different modalities, I could tell you what the evidence-based efficacy rates are. Like prolonged exposure is around 50% with high recurrence. EMDR is around 65%. And there's a bunch of modalities in around the 60%. Many of them have high recurrence. And then there's a group of interventions that have over 90% efficacy with almost no recurrence. So high efficacy and minimal to no recurrence have to be part of this gold standard. So in my pursuit, in my adventure into NLP, I first studied NLP in 1990 in Vancouver with Marilyn Atkinson at the Erickson Institute. And I didn't have the moral courage to stand up and help people who had been traumatized. And in the 1990s, I was going through my own trauma. I would have 5 or 6 or 7 screaming nightmares every week. Now I'm 190 pounds, my first wife, and there's a story, 130 pounds, and I'd wake up in the middle of one of these holographic dreams, and I'd have to get in action. So I'd grab her by the wrist and run. Can you imagine waking up 2 or 3 in the morning, being dragged out of bed and down the hall by this maniac who's traumatized? So I've been there, done that, right? So in this pursuit, when I decided in 2015 to redo all my certifications, I went back to Tad James. I did my prac. I did my master prac here in Canada with one of Tad James' master trainers. I did hypno training here in Canada. I did my trainer's training with Tad's group. And in that whole period, I read voraciously about trauma interventions for 18 months. Everything came back to NLP. Everything came back to NLP. And in that journey, I read a book by Phil Zimbardo, the former head of the American Psychological Association, the head of psychology at Stanford University. It's on the bookshelf behind me, called The Time Cure. And he has a survey that measures how we access events of our past, so past positive, past negative, how much fatalistic thought we have, meaning how much control we believe we have. He measures hedonism. It's not a place in Jamaica. It's how much pleasure we're having in the moment, and our future orientation. And when I saw those 5 areas and I was studying with Tad, I took Tad's breakthrough model and I overlaid it on Phil Zimbardo's. And what I saw, what popped off the page, if you will, was a protocol with a beginning, a middle, and an end. And what I saw was the opportunity to bring evidence-based thinking into an evidence-proven protocol. And so I called the protocol PACE, P-A-C-E, and it stands for Protocols for Achieving Coaching Excellence. Now, my wife is also an NLP master practitioner, and her and I have used that protocol for 12 years. So I don't know how many clients that would be. They're in the thousands. We've also taught that protocol to 300 clinicians who have used it tens of thousands of times. Now, the evidence I gather when I do it starts with a trauma impact profile. It's based on the Veterans Administration's trauma assessment. That's number 1, because I do trauma. But if you are working with depression or anxiety or motivation or anything else, you could have your own scale here. The second piece of evidence that I gather is called our time balance profile. Now, this is based on Zimbardo's work. The third evidence I gather is an adversity and resilience profile. And this is a survey based on adverse childhood experiences. Now, those of you who use adverse childhood experiences know that it started with a 10-question questionnaire, and then it went to a 22-question questionnaire. But it was a moment in time. It said, did you experience this? Yes or no, right? It was a binary question. And it gave you a score. So we've evolved that where we measure that at the beginning. We say, did this happen to you? And the client says yes or no. And then we said, how is that impacting you on your life today? On a scale of 0 to 10, rank the negative impact that event has on your life. Now, that's really subjective, but it gives us a measurement. Then at the end of our work, we do that same ACE, but we say, as you think about that event in your life, how is it impacting you now? And we get a delta between those two, right? We also use Marshall Goldsmith's personal assessment tool. It's called an activity card. For those of you who don't know Marshall Goldsmith, I highly, highly recommend you write or read his book called Triggers. Yeah, there's an NLP term. We do behavioral evidence. Now, this is a core piece of Tad's breakthrough in the timeline therapy, behavioral evidence. And then we do anecdotal evidence. Every session we do with a client. So every one of my clients are assessed through 6 lenses, and we gather that evidence with every client. What does that do for us? So when I meet with a client and I say, look, I have a 92% success rate, and they say, really? I said, yeah, here's the evidence, right? Here's the evidence. And when we get to the triumph section of this presentation, I'm going to share with you some evidence at this level that was done in a pilot study with women who had been human trafficking. So stay till that point. Right? Now, the protocol, PACE, has a structure. Why do we have a structure? Well, my experience coaching was that the body of NLP was so big, with so many moving parts, right? Some people like strategies. If you're a Bandler fan, he likes submodalities. If you're a Tad fan, he liked timeline. If you're an Erickson fan, you like hypnosis. So we have so many amazing tools, and our clients present themselves and they're so complex, and matching our tools to the complexity of the client can be challenging. So I thought to myself, when I saw this overlay, what would I do in step 1? Well, step 1, I want to do a rigorous assessment of where the client is today. And by mean rigorous, I want to do rigorous. And then I want to bypass the reticular activating system and get deep inside their unconscious mind to look for the root problems. Because you and I both know that client's going to have a presenting problem, but we want to get to the root problems, right? And the way I get to root problems, I'll discuss in a moment. So there's science in the structure. The first piece of science is what's called chaos theory. So if you look at our protocol from a distance, it has a shape. It has a form. We meet the client where we meet them. And every session, the first 2 sessions, we go deeper into the darkness. Then in the fourth session, we bring them out to these really positive states. In the fifth session, we go further. We anchor in, we lock in their new values, their new beliefs, boundaries, behaviors. Then in the sixth session, we actually acknowledge those. We prove them with with all the evidence. So we meet them here. We go into the deep, dark places to heal. Then we come out here and we reestablish positivity and a direction for their life. So that's the overall protocol. Every session's the same way. So chaos theory says what you see from 100 miles, you see from 10 miles, you see from 10,000 feet. So as we zoom in and you look at an individual session, we start the session, we meet the client where they come, we go in, we do some work in the deep, dark recesses of their unconscious mind. And then at the end of the session, we bring them up to this elevated state with new behaviors, boundaries, beliefs, and then we set them free, right? Same structure. And then if you zoom in even closer, every technique within every session within the overall protocol has the same shape and form. We meet the client where we meet them. We go in, we do the work, we bring them out to a higher state, and then we move on. So there's the chaos of it, the structure of chaos. And then we employ Ultradian cycles excessively, or intensely is probably a better word. Every session is 2 hours long because I want to capture a complete Ultradian cycle. Milton Erickson, I learned this from Milton Erickson, who did 90-minute sessions because he captured a full Ultradian cycle, and he used to like when people yawned. Then I like to work every 2 or 3 days with a client. Why every 2 or 3 days? Because of the knowledge around memory consolidation and reconsolidation. And consolidation means you're having an experience right now if you're watching this video, and that's in your short-term working memory. Tonight when you go to bed, you'll enter one of those Ultradian cycles. That memory will be moved from your short-term working memory into long-term memory as a coherent long-term memory. That's the process of consolidation. If you recall this video, maybe you're talking to a friend and you say, I saw this most interesting presentation on trauma and the application of NLP. You will have reactivated that memory. So now it's back in your short-term working memory. And that night when you go to bed, when you're in one of these Ultradian cycles, you'll move that from short-term working memory back into coherent long-term memory. And every time that memory gets activated and reconsolidated, it reconsolidates newly. And that's a key piece for you to know for helping people heal. All right. So in the whole process, we have 6 steps in our protocol. The way we teach it is we teach the protocol theory. Why a protocol? We teach the protocol structure. We teach our pieces inside our protocol. And we have lots of things inside that protocol from outside of formal NLP. We have a lot of breath work in there. We do some things from various schools of NLP. We do some meditation. We do a lot of eye movement, the new science of eye movement. So there's lots in there. But we always tell people, take this protocol and put your own magic in it. So if you have a specialty, maybe you're a somatic healer and you have that specialty, bring your gifts inside this shape, inside this form to enhance it and make it yours. I was fortunate enough to work with an agency that helps women who have exited human trafficking. And we did a pilot study with 14 women. We started in late 2024, it finished in 2025. And the results were stunning. So I used my protocol, but I did it in a highly structured form. So each person got the identical protocol. Step 1, step 2, step 3, step 4, step 5, step 6. Identical. They couldn't get extra time. They couldn't do anything different. I hired a third-party psychometric assessor to do their pre and post assessments. And I want to share with you the results. So there was 14 trafficked women. They ranged from 23 to 52 years old. Their mean age was 39.2 years. 4 were unemployed or on social assistance, and this will become important in a moment. 10 were employed or at school or a combination of those two. All had experienced multiple prior therapies without success. Now, on their initial assessments on the trauma impact profile, it has a maximum score of 80. Anything over 23 is diagnosed as PTSD. Anything under 10 is below the diagnostic criteria. So under 10, you're trauma-free. 10 to 23, you're coping. Over 23, you have PTSD. Their initial individual assessment range was 14.2, so coping, to 75 out of 80. That's a person who's out of control, right? The mean of their initial surveys was 45.9 out of a possible 80. So this is a highly, highly, highly traumatized group. As I said, we used a third-party independent psychometric assessor. We did the 5 2-hour sessions rigorously. The mean duration of the time working with the women and then a 2-week break before we did their exit interview was 34 days. Now, anybody who knows psychotherapy for PTSD, 34 days from having a score in excess of 23 up to 75, and then score below 10 34 days later. This is warp speed. This is faster than light, right? Most people are in therapy for trauma 26, 52 weeks or 2, 3, 4 years, right? So here's the results. 3 women withdrew, 11 completed the program. The 3 that withdrew were on social assistance, right? So they weren't working and they weren't going to school. And I'm not a sociologist, but that may be important for somebody else to study. Of the 11 who completed the program, 10 out of 11 scored below the minimum criteria of 10, the diagnostic criteria of 10. And 1 woman experienced minimal change. So 10 successes out of 11 is close to, it's 90.9% efficacy, right? And of the women who completed the program and were below the mean score of 10, their diagnostic score of 10, their mean was 2.1 out of a possible 80. So in terms of studies, that's extraordinary. Now, please, please, please understand it's a pilot study. It's not rigorous research. It wasn't a, what do they call that? When you have a waiting list and all those other features. But it tells you the veracity and the efficacy of what we do in NLP. Now, I'm going to put a link below to that pilot study. It's sitting on a website called Zimbardo. Zimbardo is the research site of the CERN Institute in Switzerland. So you can read that pilot study there.